Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you again for joining us this morning. Let's just jump right into it. I want to start this morning by discussing the vaccines. You had recently mentioned that Guyana is going to receive about 104,000 doses of the AstraZeneca vaccine. On that note, we'd like to discuss a little bit about this particular vaccine. Can you say about the interim efficacy results and of this Oxford vaccine?
Well, right now the WHO had convened an expert panel yesterday, and that expert panel concluded that the efficacy is around 63% for the vaccine. When they did the clinical trials, the third phase clinical trials, it was done in a number of countries, so in South Africa, in the UK, in Brazil, and so forth. And if you take the data from each of those countries, the efficacy would be varied. And that is why the expert group yesterday concluded that they will be using 63% as the efficacy. But within the trial itself, as I said, the trials conducted in different countries showed different levels of efficacy. So in one case, they did a subgroup of people using a half dose as the first dose and a full dose as the second dose. And in that particular subgroup of persons, the efficacy was higher. It was about 90%. But at yesterday's expert group meeting, the experts decided that they would work with 63%.
Okay. Has the WHO authorized the vaccine? And can you say which variant this vaccine protects against?
The WHO is in the process of doing that authorization, and that process entails, first of all, for this expert panel to meet. They met yesterday, and they have green-lighted the vaccine, basically saying that it's efficacious for use. I guess now the WHO, having the vaccine being listed on its emergency use list, would now have the second panel convene, and we expect by the 12th of this month that they would issue the emergency use listing. Once that is done, then the other mechanism, which is COVAX has been purchasing vaccine. They would then start releasing the vaccines to the countries.
Okay, I'm glad you mentioned emergency use, Minister. Emergency use authorization. Can you, for the man on the street, explain what does this term mean?
An emergency use authorization is granted by a regulatory authority for the use of the product. In some cases, they don't have all of the information. So in a case of a vaccine sometimes take maybe 5 years, 10 years to develop. And over that period of time, they would run a lot of clinical trials. They would keep testing this thing in different subgroups of the population to have a better understanding of how it works. But because of the emergency that we are facing with coronavirus, we don't have the luxury of time. And therefore, with the trials that have been done for most of these vaccine products, they use large groups of people, thousands of people. They are quite satisfied that, one, it met the safety requirements. They have been able to calibrate the dose. And when they look at the profile of the side effects, that they are minimal. And therefore, based on all of these factors, the risk, the benefits outweigh the risk. And that is why these scientific panels are convened. They review all the data, and then they'll make a decision and a recommendation. So for most of the vaccine products, it has been an accelerated development and deployment. And because of that, that's why these regulatory institutions are granting emergency use authorization, as in the case of the US, Canada, the UK, the EU, and so forth. With the WHO process, they don't grant an emergency use authorization. They grant an emergency use listing, which is basically the same thing. It's just that the terminology is different. So in the case of the AstraZeneca vaccine, that emergency use listing should be granted on the 12th of February.
Okay, great, Minister. Now let's talk about what happens when a person receives the first dose of a vaccine. How does it work?
So basically, when you get a first dose of the vaccine then stimulates the immune system, and the immune system would produce antibodies to be able to fight off the COVID-19 infection. So your body over the next couple of weeks would start developing these antibodies to respond to any potential infection. So that's how it works. Now, because this thing don't happen overnight, it takes some time before that immune response is developed. Persons would have to continue to abide by the measures. So not because you get the vaccine, that means that you can stop wearing masks or stop doing all the things that are recommended, social distancing and so forth. You still have to continue to do that because the scientists are still trying to investigate how effective these vaccines are in terms of reducing transmissibility. We don't have all the data as yet. We know for sure that it prevents, in the case of the AstraZeneca vaccine, it prevents somebody from getting the most severe form of the infection. But other parameters in terms of the disease, there's still more information to be gathered. So because of that, we'll want to make sure that people continue to comply with things like wearing the mask and so forth.
Okay, great, Minister. Now let's talk a little bit about Warramadong in Region 7. I know there would have been some spikes in cases there. What is the current situation?
Well, right now we have 47 active cases in Warramadong, and as I've said before, we have been working with other villages in the Upper Mas to get a sense of whether they have cases or not. In some of the villages, we have received the cooperation of the village and we have been able to take samples and so forth. But in others, there have been very strong resistance. And we hope that the village leaders and so forth would reconsider, because we are all doing this to ensure the safety. First of all, to understand whether they have active cases, and if they do, to get them to take the right measures so that they can protect themselves and the village population. So we're still in talks with some of those villages that are a little bit resistant, and hopefully we can change that outcome. We have done a lot of sensitization in that area, explaining to them the disease, how it's caused, how it's transmitted, what are the precautions you need to take, and so forth. And hopefully we'll get more cooperation. In Warramadong itself, as I told you before, there's the secondary schools students there, and some of them have been infected, so we've isolated them in one of the dormitories and we have been monitoring them. So far, everybody that we have in that area has had a very mild form of the disease, and we didn't have anyone who needed hospitalization or anything of the sort. So basically, it's just to isolate them, monitor them, and you know, if there's a requirement that people would have to be sent out, then we'll do that. But so far, we haven't had any cases like that.
Okay, you mentioned it's 47 in Warramadong, but in Region 7 overall, do you know the number of active cases?
I don't have the number right now, but that's the place that stands out because of the amount of cases that we have.
Okay, and to your knowledge, at this moment, there is no active case that requires ICU hospitalization or anything?
At this point, no. Most of the cases are either asymptomatic or very mild.
Okay, Minister, thank you for that. Now we are going to turn our attention to the COVID-19 education segment. Is there a risk of severe allergic reactions when the COVID-19 vaccine is taken?
Well, with the vaccines that are currently in use, the There hasn't been anything reported with the AstraZeneca vaccine in terms of an allergic reaction. There have been cases where persons who had allergies, when they received the mRNA vaccines, that they had reactions to that vaccine. But these are extremely rare cases. So excepting for the mRNA vaccines, we haven't really seen anything of the sort. And because of the first two cases that they saw in the UK, when they start rolling out the mRNA vaccines, the UK has issued guidelines pertaining to persons who have a history of allergies to explain to the team that is doing the vaccination whether they have allergies, and on a case-by-case basis, they're being reviewed to determine whether they meet the requirements to be administered the vaccine. And I guess the same would have to be done for, when you administer these vaccines. If people have a known history of allergies, then they should let the persons who are administering the vaccines know.
Okay, so I hear you mention allergies, Minister, but can you say if it's safe for someone with an underlying medical condition to take this vaccine?
It is, because they are one of the sets of persons that we want to protect. Because remember that the people who are more at risk for COVID would be older people and persons with comorbidities. So if you have things like heart problems or cardiovascular diseases, hypertension, kidney diseases, and so forth, this is the category of people that we want to immunize because they're at higher risk of getting COVID. So indeed, people with comorbidities can receive the vaccine and it has a protective effect.
Okay, now we have a question from the Guyana Chronicle, Minister. They're asking if you can walk through the vaccination distribution mechanism for hinterland communities.
Well, it's not a new process. As you know, we have been doing a lot of immunization across Guyana. For children, we do about 18 different antigens, so that's quite a lot. And we have been, with most of our immunization programs, we have reached about 98% coverage. So we have had a good experience, and we have a very large network across the country as it relates to immunizing people. That's the network that we are going to use. So in every region, and in some cases in the sub-regions, we have vaccination storage sites. And what we are going to be doing when we receive our vaccine is to distribute based on the population. Vaccines would go to these storage sites. And then from the storage site, the teams that we have trained would pick up the vaccines and then go village to village and distribute them. In terms of the vaccines that we'll be using when we start rolling out would be the ones that are between 2 to 8 degrees Celsius. So using ice boxes, we can easily get that out to the community and be able to do that immunization in the community. So we don't anticipate much problem with the type of vaccine products that we'll be using.
Okay, thank you for that, Minister. Now we'll be joined by Mr. MESHACK Atkinson from MTV News Update. MESHACK?
So, Minister, apart from Region 7 Warramadong, are there currently any other villages across Guyana that you're monitoring?
We have, in every region, there are places where we have seen cases, and we continue to monitor them. So in every region, there are cases, active cases. But what we have seen in Warramadong is there's a large number of cases, and that's why we have placed special attention at Warramadong.
Just a follow-up question on the new COVID-19 vaccine. Would pregnant mothers be more at risk of taking the vaccine?
There's no indication that the vaccine cannot be given to pregnant women. However, the data in terms of these vaccines. The vaccines, when they were doing the clinical trials, was not used, or pregnant women were not part of these clinical trials, so there's no specific data pertaining to that. But from all the scientific literature, there's no indication that it should not be given, and that is why that would be a choice that people would have to make.
Thank you so much for that, Minister, and thank you for your questions today, MESHACK. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.